Hi.
So Dr. Durkin, tell us a little bit about glaucoma.
Well, I think glaucoma is really interesting because it's like a wide-ranging group of subjects. Glaucoma is not one condition, but it's a group of different conditions that all cause the same type of end result in the eye, which is damage to the optic nerve that's progressive. It gets worse over time, and it causes some loss of the peripheral vision and could eventually lead to blindness if it's untreated. That's really, like in a nutshell, what glaucoma is. And so there's some things we do when we consider glaucoma. One of them is we want to look at the nerve itself and see what it looks like. We can take some scans of the optic nerve called an OCT, which show the detailed structure of the nerve. But then we can also look at the function of the optic nerve, which is the visual field test, and that checks how the peripheral vision is functioning and how sensitive the eyes are to light in all the different spots in the retina. Taking all those pieces of data together, along with the person's pressure in their eyes, their family history, the other factors like age and race and stuff, all have a role in how risky it is or how much risk someone has for glaucoma. So there you go.
Why is it important to have the eye pressure checked every year?
Well, the pressure inside the eye, it's fluid pressure. It's like what keeps the eye inflated. And glaucoma often is associated with high pressures in the eye, but not all people with glaucoma have high pressures. It seems that in glaucoma, there's some kind of problem where the pressure in the eye causes progressive damage to the optic nerve, and the treatment of glaucoma revolves around bringing the pressure lower. That's really the only treatment there is for glaucoma in our current scientific knowledge. So knowing what the pressure is and where it's been and how it is now compared to where it used to be is all useful information to determine whether or not the risk of glaucoma is high, medium, or low, and if someone has glaucoma, how well their treatment is working. So that's why we check it.
So would I feel pressure building inside my eye?
No, you can't really feel the pressure in the eye unless it's super high. So, if you press on your eye, you can cause the pressure to go really high, and of course you can feel that. And there are some certain conditions where the pressure in the eye can go up really dramatically. Those are very rare, and you would feel that. It would be a painful eye, it would be red, it would be cloudy vision, and those are a true ocular emergency that need to be dealt with right away. But in 20 years, I haven't had a patient walk in that had anything like that. It's not to say they never occur, but the vast majority of people who have glaucoma don't feel any different. They don't even notice anything's changed.
If you diagnose me with glaucoma, what are your options for treatment?
Well, there's a lot of options. The most conservative approach would be to use some drops to control the pressure inside the eye to bring that pressure down. Then there are surgical techniques. We usually would refer someone for surgery to a glaucoma specialist who can use either a laser procedure to get the pressure to come down for a period of time, or they also have actual surgical procedures to decrease the pressure in the eyes. Those are usually reserved for more severe cases or when they don't respond normally to drops. But those are the major ways of treating glaucoma. The majority of folks that I treat for glaucoma are taking one or more eye drops to bring the pressure down lower and keep that low over time.
So what is the best thing that I can do to keep myself from getting glaucoma?
Well, you're not going to be able to keep yourself from getting glaucoma, but the best thing you can do to reduce the risk of vision loss is to get your eyes checked once a year. And if your doctor would think that you are at risk for glaucoma, then there's extra testing that we do to look at the structure and function of the optic nerve, and tracking that over time to look for progression is really what's going to determine whether or not we consider that glaucoma or not. So if someone's optic nerve is getting thinner over time and they're starting to lose some peripheral vision, that's the good sign that that person has glaucoma and needs to be treated with medication or surgery to bring that pressure lower. In someone whose eyes never change, they look the same from year to year, and they don't have any high risk factors for glaucoma, those people we can often just watch every year or every 6 months and go without treatment. But you can't really prevent or even predict who's going to get glaucoma, and certainly there's nothing that we know of that you can do to reduce your risk, like diet or exercise or nutrition or supplements or anything like that. So the best thing is just to keep on top of it. And the worst thing that happens is when someone has glaucoma for a while and doesn't know it, they can lose significant amounts of vision in a few years. I've seen that a few times where I had a patient come in that hadn't had an eye exam in 3 or 4 or 5 years. Their pressure was pretty high and they had definite significant loss of vision from glaucoma. And if they had come in a couple of years before they had lost vision, it would have been much easier to treat because we would have been able to prevent that vision loss that they've had. And basically all of the people that I see that are in that category wish they would have come in a couple of years ago or a year prior, so that we could have caught it before it caused vision loss. They're always kind of filled with a sense of regret. And I try not to dwell on the regret, but just to say, well, right now we're at a stage where yes, this has happened, but we can still try to prevent further loss. But almost universally they say, oh man, I wish I'd come in 2 years ago.